right, our main speaker is Tim Guilford, MD. Dr. Guilford is both a clinician and a researcher. His education includes Johns Hopkins University for the undergraduate degree, the University of Texas Medical Branch for medical school, 2 years of general surgery at Johns Hopkins Hospital, and an ENT surgery residency at the University of Michigan and board certification in ENT. Dr. Guilford has been in practice since 1979. He's a researcher and an expert in glutathione.
I'm on. No, that sounds all right. I've actually, I kind of wonder about myself when I hear all that basic education that I had. I wonder how I ended up doing what I'm doing. Not long ago, amongst the many things that I've learned along the way, I have been using homeopathics, and one day, not too long ago, my wife turned to me and she said, you know, after all the years that we went to medical school and 2 years extra surgery and all this type of thing, she said, did we do all that so you could put drops under people's tongue? And I just looked at her and I said, I'd never thought about it. I said, it really puts everything in a different perspective, but that's what I've done. And so along the way, I thought I would try and do something that I could show worked. You know, I mean, a lot of these subtle mechanisms that we've touched on briefly have affected people very profoundly, but it's very difficult to do a study within the model that medicine has required, a double-blind study, for example, because not everybody needs the same thing in the same dose, for example, with homeopathics. So it's very difficult to do a study, and yet there are many studies showing homeopathics do work. But along the way, I decided I would do something that you could demonstrate actually was real and was there. So I helped formulate a liposome encapsulation of glutathione. Glutathione is a liquid, it can come in a powder, and it's been around for 125 years. It's been sold to the health food stores for about 40 years. And there have really not been many studies showing that plain glutathione taken orally can have an effect. So I decided to put it in a liposome and began doing studies to demonstrate that it had an effect, and I'll show you a few of those. And I think we're gaining more information all the time. You know, as you gain information in the basic science, first everybody says, well, that was just cells. So you move to animals and they say, oh, that's just animals. They forget that humans are animals too. But we're now approaching the stage where we've shown benefit in people, and we actually have a study done in children that shows that taking the oral Readisorb Glutathione, which is the product I've worked with, and that's the one that I'm going to draw the information from. I'll not give you a persisting commercial. I may refer to it as just plain liposomal glutathione in a generic sense, but they're not all the same. And as soon as I start into that mode, then everybody says, well, what about this, you know, attribute, and what about that? All I can do is talk about the one I've worked with. So that's what I plan to do. And if you generate any questions, this is my email. And the other thing is we have now 8 published studies, peer-reviewed published studies. And, so I took those studies and about 10 other studies that I've now been involved with publishing. Some I was just a co-author, and some I was a primary author. And I put those at drguilford.com, and then when you get there, you'll see your little index at the top. You can press and see the papers. Many of them are online, but if they're not, just write me, and if you're interested, I'll be happy to forward a copy of the paper for educational purposes. The other thing, if you want to join the newsletter that we send that keeps people up to date, I'm hoping that, I know that 2 different papers from 2 different university studies are going to be written up at the end of this month. When they'll be published will depend, of course, on how quickly they're accepted. And I've learned that in science, you can't predict anything. I've learned all the hard way. And anyway, you can go to Readisorb in the contact area. You can put your name in and it'll put you on the email list if you're interested. So I also want a bit of housekeeping. Over the years, one of the things that I got interested in was chelation, what's called chelation with EDTA, a material that binds metals, especially lead, for example, and pulls it out of the body. And so I've offered that to many people, and it's been gratified to see benefit in a lot of people, particularly people with chest pain, for example, from exercise, but they were not at the point that they needed therapy or mainstream surgery. I always recommend that people get cardiology consult before I offer them EDTA, for example. And so this has been around for 50 years and has generated a lot of controversy. It was over the years. So I wanted you to know, have you heard of the TAC trial? So this is it's something about chelation therapy. I forget the first portion of the acronym, but you can look up TAC trial and EDTA chelation. And here's the primary author is Lamas. And it was just published 2014. And it was done last year, and they actually broke the code on the trial because there was concerns about safety, and it turned out that the EDTA chelation is safe, infusion of EDTA is safe, and there were no major side effects. They were using people that have had previous MI, because people that have had one MI have a very high risk pattern of having a second MI. And so they used that group because they would have a fallout, that they could measure statistically. And anyway, it showed that there was definitely a benefit. 28% of people improved, and they were just using endpoints. They weren't looking at metals. Why they didn't look at lead, which was why EDTA was originally cleared through the FDA, I don't know. But if you have diabetes, you had a 38% improvement in significant side effect like second MI or death or stroke, stuff like that. And so it was shown that it had benefit. And there's a fellow named Roy Heilbrunn who's a cardiologist, and he actually was in his training. Lamas is from the University of Miami. And Heilbrunn was in the training and was involved in that study and has gone on to use chelation in his practice and has written at least one book, which I'm showing you here, Royal Heilbrunn, Heilbron, showing the benefit of EDTA chelation in atherosclerotic heart disease, and also here's the title of the latest book. So I would urge you to look into that. And in a way, it's a vindication of things that I've chosen to get involved with, and it finally is a trial showing that it's safe and efficacious. Of course, they need more work. That's the standard response from mainstream cardiology. It only took $30 million to do this study. So, I mean, it's a pretty big deal to get these kinds of things done. So we're going to talk about glutathione tonight. And just basically, it can work directly, as well as this unique antioxidant can work with enzymes. And this is what separates it from other antioxidants, in my opinion. It turns out that every nucleated cell on the planet makes and uses glutathione, plant and animal. It's really fascinating in that regard. And it works also in the detoxification of reactive oxygen and nitrogen species. I'll talk to you about that. That's a little bit of a summary. So it shouldn't surprise us that you're going to see glutathione deficiencies or dysfunction associated with many health conditions, starting with cancer, diseases of aging, cystic fibrosis. They're missing the enzyme that carries glutathione into the lung alveolar space, cardiovascular disease, inflammatory disease, immune diseases, and neurodegenerative diseases. When I started reading about glutathione in the mid-90s, I became fascinated with it because I had run an allergy immunology lab prior to that. Although I trained in ear, nose, and throat surgery, I think understanding the basics of inflammation are really important. And glutathione, when it's low, will skew cells towards chronic inflammation, which includes allergy-type symptoms, and is even involved with autoimmune diseases. And you'll see more and more about that with glutathione over time. At the same time, I was doing chelation for people and wondering what was the problem that caused mercury to be toxic. So I went to the library, back then pre-internet, I used to roam around the library at midnight, and found that the first article and the major thing that they showed with mercury is that it depletes glutathione. So all of a sudden my two worlds collided, and it started me on a journey that I'm still on today. And I spend a lot of time reading about glutathione and depletion of glutathione. If you're a speed reader, you can read all this. You can see that it influences inflammatory potential, dysfunction of intracellular signaling, including P53. Each of these is very important. But I just wanted to show you that it's also involved in the blockade of the methionine cycle. And we'll talk about that a little bit. So in other words, the glutathione, and I'll show you these cycles, which is the end product that starts with the methionine cycle, can actually, if it's not available, slow that cycle down. So since the time I started reading about glutathione back in the 90s, this starts in 1995, I've been working for 10 years with the liposomal glutathione product that I work with since about 2004. The number of articles under the single word search glutathione in PubMed has gone from 10,000 up to 115,000 articles. So, I mean, I don't know how you're going to catch up if you start reading about glutathione. I've been reading, I used to read all night. Now I just read day and night. So, so when you look at it as a detoxifier, it takes care of both xenobiotics, that's from outside, and endogenous compounds. I'll show you that again. But it facilitates the plasma membrane transport of toxins by at least 4 different mechanisms. And I'm not going to go into all of that, but that's the real key with glutathione. It's both an antioxidant and a detoxifier. And your cells make it. And as long as you're making it, everything's fine. So the PubMed article I mentioned, the last one, it was number 115,015, was titled Degradation in Urban Air Quality from Construction Activity and Increased Traffic Arising from Widening Roads. Now that would be, I couldn't figure out, I mentioned that to somebody, and they said, well, it came up under glutathione, right? I said, yeah, and they said, well, we'll look at it. So I read the abstract, and it says that it puts stress on your glutathione-related antioxidant or oxidative system. And so it reminded me of an article I read a few years ago. It showed that the closer you live to a road, this was in England, the higher concentration of carbon particles you could find in your lungs and in your blood. And they use people with type 2 diabetes because they seem more susceptible. And type 2 diabetes has been shown, and type 1 have been shown to be deficient in glutathione. And one of the articles that is coming out from the university group that I work with will go into the mechanisms of this loss. Anyway, these people had an elevation of oxidized LDL. Well, what's oxidized LDL? Well, that's the oxidation product from regular LDL cholesterol. And it's been shown to deplete glutathione and the reductase. That's really important. I'll show you that cycle. So I need to move along. But it promotes chronic mitochondrial dysfunction, and that should sound familiar. And if you increase the glutathione present, and that's what they did in this study by increasing the function of glutathione reductase, which recycles glutathione, they could change that, the mechanism with oxidized LDL. So it's the major lipid found in atherosclerotic lesions. It's the trigger for atherosclerosis, and that's been acknowledged by a number of studies now, major risk factor for atherosclerosis. So the first study we had done with the liposomal glutathione I work with showed that if you put the product into the blood taken from a healthy person to whom they had added a lot of excess copper ions, they can create oxidized LDL. And if liposomal glutathione was present, it reduced the lipid peroxides formed by 90%. And if it wasn't present, of course, there was no change. And it happened between 1 and 2 micrograms per ml, which turns out to be achievable with the oral liposomal product that I work with. So it's not, it doesn't take very much. Anyway, it showed that the macrophages from these mice, this was done in mice, ApoE knockout, the lipoprotein carrying agent ApoE was removed, so these mice get atherosclerosis prematurely. It showed that they had an increased HDL-induced cholesterol efflux from their cells, significantly higher than the mice consuming liposomal glutathione. And that resulted in a reduction in the cholesterol mass in these macrophages. And that's important because that's what causes the lesions they call the fatty streak. That's the beginning of the atherosclerosis. And it reduced the atherosclerotic plaque in these mice by 30%. Now, we don't have a human study, so I can't make any recommendations. And I do want to say I'm not making any claims for treatment or diagnosis, you know, that standard FDA warning in any of the things I talk about. So chronic exposure to these various materials in our world is met by an increase in glutathione. And in fact, that's what happens when people train for marathons, for example. The total glutathione increased at 20 weeks of training, but by 40 weeks it went back down to normal. They had developed a whole mechanism to manage this, and at first they were oxidized and stressed, but that your body can respond to this. It's also interesting that glutathione has transferase activity it went up and stayed markedly elevated. And I'm not sure why. Maybe they're breathing in, maybe they jogged by roads, for all we know. You know, that wasn't in the study. It's also interesting that riboflavin content of the erythrocytes, blood cells, increased by 40 weeks. And I'll show you where all these different vitamins plug into the production of glutathione. So there's a bunch of diseases associated with low glutathione. And I mentioned those, and there may be a few others in this list, but I'm going to talk on cancer in a couple of months in regard to oxidation stress. Diseases of aging, we're back to some of the ones that we've already mentioned before. But when you're deficient in glutathione, it's a standalone marker for a number of these conditions. And I mentioned, well, we mentioned the pollutants are, you know, a big, are removed primarily by glutathione and other mechanisms. So I've also got to publish an article that came out this year that shows that mycotoxins, the toxins from molds, the part of their pathophysiology is the depletion of glutathione. I'm really proud of this because it took a lot of work to write the article, and it took even more work to get it published because it wasn't so much contentious, but they wanted me to review a lot more literature than, and I had already thought the article was much too long. But I'm recommending it. It's online, and you can find it with my last name and mycotoxin. It'll come up on a search engine, usually the first one. And it's a little esoteric as far as the mechanism. It's really fascinating to see how these mycotoxins work if you're into the science. But it's a very nice review of the formation of glutathione. So if you missed something in my presentation, then you can go to that resource and read about glutathione there. And as far as detection of mycotoxins, they become important because it's been shown that that occurs in fatigue syndromes, and including fibromyalgia and Lyme disease. People with these problems, Lyme disease symptoms that persisted in spite of antibiotic therapy. And these mycotoxins were shown to be present in the urine of people with that criteria. And so that's an emerging area that you might not have heard about before. Very few physicians are familiar with the effect from these mold toxins, but this is the way molds cause problems, and I think they play a big role in allergy in general, but that remains to be proven. So everything's fine with glutathione because you're making it and you're healthy until something happens. Well, what could happen? Well, you can have a modification of the oxidant stat material, a protein that turns on the production of glutathione that's released when there's too much oxidation, and this occurs in chronic asthma. You can have SNPs, single nucleotide polymorphisms, in the enzymes that put glutathione together with cysteine and ligate them. You can have SNPs in the GSTs, and the GSTs are the ones that is a commonly tested single nucleotide polymorphism SNP. There's 3 of them, and about 40% of us are missing at least one of them, the GSTM. And what that net result is that your glutathione system doesn't work as efficiently because those enzymes, I'll talk to you about that in a minute. And then transforming growth factor beta is increased with a lot of inflammatory diseases, and it's incongruous, but for some reason elevations of TGF-beta can shut down the formation of glutathione. And we have a published article that talks about that occurring in HIV disease, for example. And they show that if you give the whole molecule of glutathione with a liposomal glutathione, you can get a significantly improved response. So Glutathione S-transferase works like a matchmaker, introducing glutathione to the toxins, both physiologic metabolites and xenobiotics. And I mention that because that gets back to the attaching glutathione to mercury, arsenic, or lead for removal from the cell. And that's how these things get out of our body. And methylmercury takes one glutathione molecule and attaches it, and the body thinks that, there's articles that have shown that it looks like the oxidized form of glutathione, which is exported out of the cell into the bloodstream, carried to the liver, and then removed through fecal excretion. So when you're doing these detoxification exercises that Susan talked about, be sure you have normal bowel function and you're keeping your bowels moving normally with both the standard recommendations of fibers, but I use vegetables a lot. I just tell people need a lot of vegetables. That seems to help. Drink water, and magnesium. Magnesium is really critical for bowel function. If you're having to strain at stool, you need a little bit more magnesium. And it may be a irritant effect in the gut, but it also suggests the individual is low in magnesium. So glutathione itself is a straightforward molecule consisting of glutamine, cysteine, and glycine. And the glycine is, the cysteine is the active component in the middle of this structure. It's got a unique platform that allows it to remain stable in the cells. And the cysteine in this form has an available hydrogen that can be released along with an electron, and that's where the antioxidant effect comes from. So when it's oxidized, two glutathiones prefer to each glutathione to grab the other, and there's a double bond between the sulfurs that are formed. So this is the acronym, the abbreviation reduced glutathione, and oxidized glutathione is GSSG. And to think of free radicals, some of the early work in forming free radicals was using ionizing radiation, which splits a hydrogen off of an OH radical. Well, what does that mean? Well, that OH wants to grab another hydrogen. It wants to be stable. So it'll grab hydrogen from wherever it can, and these polyunsaturated membranes in our body have the hydrogens less attached at the sites where the double bonds are, and they can grab that hydrogen off there and create a free radical, and that can in turn create a chain reaction along that membrane until something comes along that will stop that. Vitamin E can stop that, but glutathione and the peroxide of glutathione play a big role in stopping that changed mechanism in the formation of these lipid peroxides. So reactive oxygen species will attack membranes, enzymes, proteins, and nucleic acids. So that's where these problems come from. But it took me a long time to figure out a way to describe what a free radical is, because you read about it, but you don't really ever understand it. Now, most of these free radicals, reactive oxygen species, come from the mitochondria themselves. There's a whole mechanism there, but it's also involved with iron and copper happen to be in the mitochondria. And that's through a reaction called the Fenton reaction. There's not going to be a quiz, but that's the answer for the quiz. And so in the mitochondria of the cell, that's where your energy is produced. That's also where you're producing the majority of your free radicals. That happens to also be a focal point for iron metabolism, and cadmium happens to affect the mitochondria also. And it turns out when they infuse mercury into cells, from liver cells, it turned out they used in this study, but they found the mercury seemed to attach preferentially to the mitochondria, 48%, 36% in the nuclear membrane, and only 8% was in the cytosol. So that's one of the reasons mercury causes so much problem, is it attaches to these mitochondria and creates problem. Mitochondria actually import glutathione preferentially, and without glutathione, mitochondria don't work well. So all of these free radicals are made inside the mitochondria, the OH radical, and the even more tough one. If you were socked with the hydroxyl, you go, oh. If you're socked with a peroxynitrite from nitrogen, you go, oh no. So that's an easy way to remember it. So all of these are neutralized by glutathione, including hypochlorous acid, which is made when your neutrophils start attacking cells. It's released into the environment to kill the invading cells. So the normal cells need a way to neutralize that excess free radical. Now this is happening a lot in the body. You get 4 million hydroxyl radicals made in each cell every day. So you can imagine the number of times this is happening. I mean, it's phenomenal. Don't think about it because you'll tire yourself out. You know, it's just happening so much. But what's happening here is this peroxidase enzyme is facilitating the introduction of glutathione to this OH radical, and that hydrogen and the electron are they handed off to the hydroxyl radical to create harmless water. So this is happening repeatedly, and you need the enzyme. And a lot of studies don't talk about this. They'll talk about the presence of the enzyme, but you also need the availability of reduced glutathione for that to happen. And if your mitochondria can't get enough glutathione, you can lose the loss of the mitochondria completely when glutathione is depleted, and that happens in a lot of conditions. Just briefly, I'll respond. Go ahead. There are portions of the Krebs cycle that are interfered with oxidation stress. Yeah, those enzymes won't work. Yeah. So where do we get our glutathione from? We make it, and it's made starting with the methionine cycle, and methionine goes to S-adenosine methionine, SAMe, and SAH, and homocysteine, and then folate and B12, and it goes around in that cycle. And I guess I could use this and advance it. Yeah. So then that's where your MTHFR SNPs occur that you're all familiar with that prevent the folate from handing off the carbon. So the methionine cycle is just a migration of carbon around that cycle. And if it doesn't get a methyl group carbon handed off to B12, it won't function properly. And when it goes around properly, then the body will make cysteine from that, which can then work with glycine and glutamine to form glutathione. And when this is blocked, you can have problems, but also it's not well known or talked about, but if you don't have enough glutathione, you can't make the methyl B12 properly. And that occurs because glutathione will sit as an intermediate between B12 hydroxycobalamin it becomes glutathioneal cobalamin when its sites are opened up, and then something else could get in there and prevent the formation of methylcobalamin. But when glutathione is present, it will allow that whole cycle to go. So that's what they were talking about, blockade of the methionine cycle. And so more and more interest is developing on these enzymes, the gamma-cysteine ligase, glutamyl cysteine ligase, glutamine and cysteine are ligated, tied together, and glutathione synthase. And glutathione synthase can be blocked by mercury. And I had a patient who presented as chronic fatigue, but it was due to a diagnosed Epstein-Barr infection. And the parents brought him to me, finally. He was being homeschooled and not doing well. And I put him on the liposomal glutathione, and his allergies cleared up right away. And we can go in, I don't have this in the talk, but with the antigen presenting cells, I mentioned if they don't have enough glutathione, then you get chronic inflammation. I thought he was better, but the mom insisted he wasn't, and he still had a large spleen, so we continued. And we eventually found that he had an excess of mercury. And I also happened to run a neurotransmitter test that ended up looking at his taurine in the urine, and the taurine was 4 times higher. And I was working at that time with a lab that could measure glutathione in the plasma, and his plasma glutathione was low. So we detoxed him from mercury, kept him on the liposomal glutathione for another 6 months, and as that mercury came out, his glutathione level went back up to normal, and his taurine level went back down to normal. So I think it's a classic example of this pathway, because cysteine preferentially goes to glutathione, but if it has to, it'll go on and form taurine. It's really fascinating. Anyway, he's done great. He went back and did full athletics and full school. And I happened to bump into his parents on an airplane 3 years later, and they told me how fantastic he was doing. I never hear about this till chance intervenes. So the other thing, while glutathione is now available, it's not run routinely through most physicians' office. On my website at drguilford.com, under presentations, I have a list of labs where you can get glutathione levels. that are, and you can now get plasma levels routinely, but it wasn't so routine till it's just becoming. But one thing you can get is your GGT level, that's gamma glutamyl transpeptidase, and what that is an enzyme that sits on the outside of cells that actually helps bring more of the components of glutathione into the cell to be manufactured, and I'll go into that. But it breaks glutathione down into its individual components, which are then carried into the cell, and you need energy and these enzymes working to put it back together. And that's what GGT does. When it goes up, your body is saying, feed me more glutathione, please. And you can measure GGT in the blood. It's relatively inexpensive, and it's often on a routine chem panel. And if you ask your physician to run it, you can do that. And if it's elevated, there's a number of causes. That used to be nobody wanted to check it because they told the patients that if your GGT is elevated, you're drinking too much alcohol, which is very possible. But they kept telling a buddy of mine that, and it turned out I found an article that shows that GGT is elevated in coronary artery stenosis, and he ended up having a stent placed. So it's an indicator that something's not right. That's one of the problems. It's not specific for anything except for the need for glutathione. So it's elevated in many conditions. Non-alcoholic fatty liver disease, especially in children, it's been found. Alcohol abuse, pancreatitis, heart disease, I mentioned both coronary artery disease and heart failure. So the production of glutathione at the level where these 3 amino acids are put together is really critical, and there's 2 ways to make glutathione. One is by this de novo production, and the other is by recycling of glutathione from the oxidized state back into the reduced state. And you can see how that happens over here with NADP. And because of its role in supplying reducing agents, NADPH is often considered an antioxidant, but strictly it's not. And if I can figure this out. Okay, this is happening 4 million times a day. And this is where your G6PD comes into play. For people that are missing this enzyme, they can't reduce the glutathione again. And about 14% of the armed forces now have G6PD deficiencies. And that's why if you're going to take very high dose things like vitamin C, which becomes an oxidizer, if you have any chance of having a Mediterranean ancestry or North African ancestry, these folks don't have G6PD, and they don't tolerate these oxidizing stressors very well, and your blood cells can actually crenate. And it also, in this enzyme system, GCL is controlled by a catalytic unit and a modifier unit, and then we'll talk about that in a few minutes. So a lot of vitamins play a role. I mentioned magnesium. Magnesium, when it's deficient, your glutathione is often deficient. The strange thing is when your glutathione is deficient, your magnesium is often deficient. I don't quite understand that, but it's published. But you need that in B6. Niacin plays a big role in regeneration. B2, zinc is important for regeneration of glutathione. So it's a very complicated apparatus that's designed to help maintain glutathione is the bottom line. Pythagoras was Greek. He died in Italy when confronted by an angry mob. He had a field he could escape out the back of the house through, according to the history books, but he chose not to because it was a fava bean field, and fava beans are very oxidizing, and he knew from past experience that if he got into fava bean pollen, he had a big problem. It caused his red blood cells to change form, and they wouldn't flow normally, and he had a lot of pain. So he turned himself over to the angry mob. I'm sure he was expecting some leniency, but they hung him, I think. That's what happened to Pythagoras. I mean, that's really kind of a fascinating bit of history. So in people with HIV, I'll go into this a little further. For some reason, and we've looked at several reasons, the enzymes that make glutathione are compromised. They're not being expressed properly. So this GCL and GCLM are not being formed. The GS is not formed, and the GGT is not formed. This is comparing HIV to healthy, and You can see the purple is HIV, but the glutathione reductase is working overtime in that situation, and that just points out when you're stressed that GSR really picks up a lot of work. That's the same in the marathon people. So NRF2 is considered the thermostat oxidant thermostat of the cell. It's a protein that's isolated in the cytoplasm and usually kept there until oxidation stress comes along and releases NRF2. It'll migrate to the nucleus, where it's then attaches to the antioxidant response elements, which trigger the formation of a bunch of antioxidants, including catalase and others, but also specifically glutathione, the GSTs, and glutathione peroxidase. So if this isn't working, you don't get the formation of glutathione. So here's where this NRF2 doesn't act directly, but it stimulates the production of these materials, including the modifying unit and the catalytic unit of GCL. And when they're not working, when they're modified, you can't make glutathione properly. Let's see, I can go back this way. This came from a study by Ann Fitzpatrick at Emory University, and she looked at children with chronic asthma. This was done in small humans, not animals, small humans. And with bronchoscopy, she found that in their macrophage cells and that sort of thing, that they're not able to make glutathione normally. And even in that institution, there's still, in some quarters, resistance to the acceptance of the fact that asthma is a low glutathione disease and might respond if you could raise glutathione in those cells. One of the problems has been we haven't had a way to get glutathione into people easily besides intravenous infusion. And there's some, that doesn't always work. But we have a paper coming that demonstrates that in the lung you can raise glutathione with the oral liposomal preparation that I've worked with. So it's really kind of an exciting time in this evolution. And again, I mentioned you can read about the pathways that I just showed you in that article on mycotoxins. So mycotoxins were shown, I mentioned, in chronic fatigue syndrome. And if you just put up this fellow's name, Brewer, if you want to read about chronic fatigue and fibromyalgia and Lyme that doesn't respond, they found that if you had a history of fungal exposure, especially water damaged building, if you just put Brewer and mycotoxin into the search engine, Brewer like it sounds, B-R-E-W-E-R, you can read about that relationship. And that's all new. That was just published, I think, last year. Yeah, and so that's an emerging new awareness of health-related problems. So in people with HIV, the study shows that when you're healthy, you have an excess of free glutathione and here a less amount of oxidized glutathione in their macrophages. But in HIV, you have an excess of oxidized glutathione. And that's essentially the same thing that's shown in these. Here you can't read the legend as well, but this is healthy. And then down here at this level is the HIV level of reduced glutathione. And I just showed you the slide before, how they're working overtime with the reductase. But this is really fascinating because when you take an intracellular infective material, mycobacteria, tuberculosis, and you inoculate those cells, in healthy people, you don't get too much replication. This is healthy here. But in people with low glutathione in their macrophages, you get a very significantly increased replication of bacteria. And so this points out how important glutathione is in both killing cells and supporting your macrophage function. And NAC was helpful. That's a precursor. It's a material that gets into the cells, N-acetylcysteine. Took 10 millimolar to get a reduction in the macrophage, the mycoplasma replication. It's colony forming units per ml. But it took 1,000 times less with the liposomal glutathione, only 5 micromolar, to achieve the same or greater reduction in replication of those bacteria. So it really points out how important glutathione is in maintaining your defense against bacteria. In cell culture, plain glutathione had been shown to replete cells. They used astrocytes in this cell culture that were depleted of glutathione. And it took 500 micromolar to replete, to bring them back up to a normal level. It took only 5 micromolar of the liposomal glutathione to achieve the same. And the theory here is that the liposomal glutathione is carrying the liposome is carrying the glutathione right into the cell does not have to be reconstructed, where plain glutathione helps, but it has to be broken down by GGT and then reconstructed inside the cell. And as these cells get compromised, you have less and less ability to do that. This was done by Gail Zivak at the, yeah, I kind of know when I press, but it'll go away, maybe? No. Thank you. Well, it may all go. Thank you. Gail Zivak at the University of New Jersey Medical Dental, and she was published many papers on glutathione, including one that talks about glutathione in Parkinson's disease, and then she has a colon in the title. She says, is glutathione the elephant in the room when talking about Parkinson's disease? And we tried to get a study going there, but the professor wanted to see more animal work first. And unfortunately, Dr. Zivak decided she didn't need to put up with the NIH grant system anymore, and so she could retire, and so she did. But she's been very helpful in talking to the other researchers that have continued with this work. And finally, we had a study. This was done, I didn't know it was being done until it was published, actually, because I'd sent the glutathione up to this lab for another purpose. They showed that it helped reduce the damage on the skin from radiation, cobalt-60 radiation exposure. They had the glutathione, they put it into this study. They were mandated to look for ways to get rid of cobalt out of the body, as if it were blown up by someone who intended to inoculate a large group with cobalt-60 dust, for example. So they put this into the rat, and then this is the data coming from the liver of the rat. They knew that IV glutathione would bind cobalt and help remove it, and it removed 65%. Liposomal glutathione that I worked with was able to remove 75% of that same amount. And the plain glutathione given orally did nothing. And this was done over 5 days. So it's a relatively short period of time, but it shows you that, IV glutathione would be very helpful, but it's really much more practical to take an oral form that you could take on a regular basis. And there was a control, so it's really fascinating. So that's, well, we got plenty of time. I'll keep going. I plan to cut off at, I can never tell how things are going to go, how fast. I always tend to put in too many slides. So SNPs in that GCLM are starting to become more and more recognized. This single nucleotide polymorphisms. In a DNA molecule, you get one from your one parent and the other from the other parent, and you usually have 2 genes being represented. And if one of them is missing, if there's a little alteration in the different amino acids that form the gene, it won't be represented on one side or possibly both sides. And so if it's on one of them is out, they call it heterozygous, and if it's on both sides, it's homozygous, meaning both representations of that gene are not present. And in some cases, you won't make the product, but in most cases, it means that it's inefficiently being made. And so a lot of people run these detoxification profiles for GST. That's been available. The ones that I showed you for the GCLM and for the enzymes that make glutathione, they're not available as yet. I suspect they will be because there are research articles that show they're deficient in a number of serious conditions, including some brain function, chronic metal accumulation, diabetes type 1. This is the modifier unit. Similar findings were found in portions of the brain in autism. This is just a couple of years ago. I was going to point out these long strings of numbers go roughly, we're now in the 2,500. So 2014, almost 2015, starts with 25 now. So this was just a couple of years ago. They found that in portions of the brain, they were not making glutathione because the GCLM was not being expressed, and they felt in those brains that it was due to NRF2 modification, similar to what we saw in the lung with asthma in children with chronic asthma. So both glutathione and GST levels have been shown to decrease with aging. And this is likely to be one of the causes of the problems that we run into after we've been on the planet exposed to these different materials for a length of time. And there's some evidence in some of these studies that show that you actually don't, the enzyme itself is not as tightly bound to cysteine as it was when you're younger. And so you don't make the glutathione as efficiently. It's really fascinating. So the capacity for de novo glutathione biosynthesis may be compromised during the aging process due to the lack of the catalytic activity for this GCL, the glutamylcysteine ligase. So a variety of materials lower glutathione. Acetaminophen is one that's enjoyed a lot of publication, but you never hear about it. Were you aware that you know what acetaminophen is? And right, I don't like to use that as brand names because I don't want to. Nobody wants to mess with. That's a big company. And but they've shown that it depletes glutathione, so it's just one of the things that requires glutathione. Nitrates lower glutathione, such as digoxin. And I noticed that an article came out that Stanford showed that digoxin may not be the best choice for the long term. They didn't say why. I don't believe they got into the glutathione part, but that's been shown. And I try and show references for all the statements that I make. So these are not my ideas. I'm just passing on what's published. So systemic lupus erythematosus, SLE, it's not a really common disease, but occasionally you'll see that it's supposedly an autoimmune disease. That's been shown that glutathione levels are actually low in that disease. I found that really fascinating. They also mention other autoimmune diseases such as thyroiditis and some muscle dysfunction. So a number of conditions are showing up, and you're going to see more and more about that. So I mentioned the plasma levels are low in aging as well as macular degeneration and diabetes. And my last slide, when I found out that we were going to have a second speaker, I went back and I found an article that I had presented before at a hormone meeting that shows that the cells that make testosterone in both young goats and old goats won't make testosterone as efficiently if they don't have glutathione. So it shows you the importance of having glutathione around, especially if you're an old goat. Oh, and there's some comments that when you just replace testosterone, you may be increasing your oxidation stress. I don't know about that. And just as a reminder, if you want to be kept up to date on the latest research, you can just put your name into there's a little form you fill out with your name and your email. And we'll be happy to keep you informed. So that's what I had planned to talk about. And I appreciate, it's been a real honor to address this audience because I know you folks are very well informed, and I've known Bern for years, and Bern Friedlander's an expert in many areas. And so it's a real pleasure for me to present the research that I've been involved with, and I hope it's understandable. And I'm glad I got to do it with slides because trying to do this without is not possible.
Do we have questions?
Relative to vitamin C, your comments, is vitamin C causes oxidation, are you saying? Because I always thought it was healthy to take a lot of vitamin C.
Bern, you want to answer that?
Vitamin C does convert to an oxidized form.
Yeah, and I want permission to.
Back to the why, man. You're slow.
I want permission to follow up.
It does oxidize. There is an oxidation factor to vitamin C, and glutathione and alpha lipoic and vitamin E recycles it back, and that's why you need both. Another thing, a very interesting thing he said about mycoplasma, which is true. If you're going to do any form of treatment like vitamin C or anything like that, or ozone, do the glutathione prior. Otherwise, it won't work as well. Something about glutathione prior to having an ozone IV, and we spoke with Robert Rowan about it, and Frank, it actually enhances the effects of the combination and does reduce mycoplasma and mold, which he's actually right. And so always do the glutathione first.
Well, I appreciate that comment in several areas. If I said mycoplasma, I was referencing our studies in mycobacteria tuberculosis. But you're right in mycoplasma. Glutathione helps break down especially the elemental body. Well, I'm thinking of chlamydia, but it works in chlamydia also.
Any bacteria and all viruses, it has a better effect prior to any form of treatment.
Thank you. I'm glad you said that. We're going to have some data on
Did you ever
bacteria
define
coming.
liposomal?
Liposomes are, thank you, a lipid shell that has been enclosed around a fluid. And I guess I didn't put a slide in there to show that. I don't know why. But it's made with the same type of materials like phosphatidylcholine that makes up the cell membranes. And so it looks for all the world like a cell when you take it in the oral form. And the advantage with liposomal glutathione is it stabilizes the glutathione, keeps it in the reduced state, and allows its absorption. And these lipids are actually, the liposomes actually taken up. There's studies that show it will pass through the mucosa in the top part of the stomach, for example, so it goes in long before the digestive system ever sees it. And then it goes into the lymphatics, and the lymphatics dump through what's called the thoracic duct, those of you who took anatomy, into the superior vena cava, the big vein going into the top part of the heart. So the liposomes get distributed very quickly into the blood system, and then they're taken up by macrophages, and we've also shown that it goes directly into cells. So that's why the liposomal glutathione that I work with, the Readisorb, has had a chance to get into the system before it's digested or gets involved in the digestive pathways. And that's why I like it in a liquid. And we recommend taking it on an empty stomach because it seems to stick to foods. Liquid. No, I didn't. I didn't bring one, but it's a liquid, and you can mix it with juice or water, and it's stable. It's stable. It's in water already, so it's stable in juice or water and absorb well. But you don't want to take it with solid food. Hello. The question. Let me repeat the question. The question was: you can start with a few drops and work your way up to 1 teaspoon twice a day is what I use for a target when I'm seeing people that have problems that I think need to have support of their glutathione. So this lady has a microphone. She's in charge.
Hi, Dr. Guilford, thank you. This has been fascinating to watch your presentation. My name's Kiki Corbin, and I'm a certified traditional naturopath. And I've been studying this and the effects of the pesticide residues on foods now for about 2 years. It's like I've been back in college again. I've gotten to know all the researchers, not just in this country, but everywhere, asking a million questions. And what I'm noticing in my practice over the last 20 years is that we really need to give the body the forms, the end forms of supplements, rather than try to interrupt all the things that are being interrupted by environmental toxins. So your product, I've been reading about it now for about over a year, I think, all the science on your site.
Oh, thanks.
Yeah, it is good. Yeah, it's so helpful because we've got to find a way to increase glutathione. Everyone, I think, is getting, it's interrupted just because we're all polluted, basically, for lack of a better word. And what I've been noticing, I've been talking to the researchers that are working on glyphosate toxicity, which is Roundup.
Glyphosate. Yeah, go ahead.
Yeah. And so many of the parts of that whole cycle you were showing, like, for example, it binds to minerals, and it also interferes with mineral transport, making sulfur into sulfate. And so just that alone, I've been wondering, how in the world are we all walking around still being able to function with what's in all of our bodies?
I bet we've all got that glutathione reductase revved up and that whole system working better, and you're working, you're running a marathon. I'm going to make that point at an upcoming conference I'm going to present at, make the point that these toxic materials are piling up. And I think we're all running marathons. And everything's fine till something in that system doesn't work, and that's why I showed you what can happen, including the mycotoxins, which have been really overlooked.
Well, and at that tipping point, you know, we get sick when we hit that tipping point, but before the tipping point, our whole body's suffering. You're showing, you know, the statistics for that.
I'm glad you said that. I wish you could say that on the microphone, but I'll let you say it again. Next question.
Hello, yes, former patient of yours. I was just had EDTA chelation years ago. I was wanting to find out the thing about uranium or radioactivity.
Right.
Would the glutathione be
Cobalt-60.
something that's very necessary to help your body clear that?
The normal way the body responds to radiation is the upregulation of glutathione. And as long as the amount that you receive is in such a dose amount that you can respond to it, you're fine. Where it runs into problems, you're back in the marathon race, and you're also then overwhelmed with a big, heavy dose. That's why people feel bad when they take the radiation therapy in the past. I mean, they're getting a big dose of radiation. You know, look at the symptoms people have had. They get redness on their skin, but they get fatigued and tired and susceptible to infections and things like that. Glutathione's being
Yeah,
depleted.
but mine was environmental, or I should say on-the-job exposure. The other thing I wanted to ask real quick is, as far as a copper, heavy body burden of copper,
Right.
and detoxification for that, is there anything that would relate to glutathione?
Well, definitely you should support your glutathione system if you suspect an elevation of copper, and there are copper chelating and reducing agents. And EDTA doesn't generally pull copper. I think a material, penicillamine does, and another material called DMPS that I've worked with will pull copper.
Zinc is the best chelator for copper.
Thank you.
One of the questions
So the comment was to displace it with zinc.
One of the questions I've always had, if on a Sunday afternoon and you're driving down, you never stop by the hospital to get a shot of chemo or radiation. But when you're sick, you can't wait to get some of this good stuff.
I'm going to talk about that at an upcoming conference. It's another, I've got another too many slides, but I'm happy to see I got through what I got through because it gives me courage to present all the slides. And it does address the accumulation of toxins that have been documented to occur and create yet another oxidized agent in fatty tissue. It's called 4-HNE. Have you run across that? I don't want to go into try and explain. I can't remember the full acronym. But it's another product of oxidation past oxidized LDL that has been documented to occur in tissue taken from healthy people. And so, in young people. And so, and they intimate in this article, I don't want to go into it because I don't have the reference. I want to give you the reference, right? But it was done at the University of Pennsylvania in Hershey, Pennsylvania, and they've worked on it for quite a few years, and they show that this leads to changes that are associated with a cancer phenotype. And so I'm going to talk about how that leads to the metabolic process we know as cancer. And it begins to demystify a lot. You know, most of the time when you give them a diagnosis, just like you were alluding, Tom, to taking a heavy oxidation, it really questions why that has been in use. It's just become a habit. Yes.
Dr. Guilford, I've run across some literature that makes a distinction between glutathione that's used at an extracellular outside the cell and another type that goes inside the cell, and there's products out there like acetylglutathione that presumably go inside the
Well,
membrane.
they presume it goes inside. The evidence is that it may be absorbed into the bloodstream, but there's no evidence it gets inside the cell. And that's why I mentioned the studies. I don't like to talk, I haven't studied other products. All I can tell you is what the product that I've worked with, the Readisorb, can do, and we've documented it gets into cells. And they've done this in cell culture very clearly. I don't doubt that people have felt better with these other products. I just have had a good experience with the one I use.
So it seems like you presented some research that shows that in the case of certain diseases that glutathione is reduced, but I wasn't clear. Did you also show clinical trials that show that if people take this liposomal glutathione, that it reduces the incidence of these diseases in real clinical trials, or is there no such research?
I tried to be clear and say there have not been trials that demonstrate that. So I can't make any statement about disease states, and that's why I spend so much time talking about the function. We do have a study, a clinical study in children with autism that shows you can raise glutathione from a low level, which they have, and it's documented, up to a normal level. It was a low normal, but it was a significant increase in glutathione using the Readisorb. But aside from that, there have not been any clinical studies. Now, there may be in the future. That's what I was trying to say. We were working toward that, but we're not at that point. So if you want to wait for the study, that's okay with me. I mean, I can't promise anybody anything. I just tell you, I've had great experience supporting glutathione over the past 10 years. And
the other question I remember in my tidbits of information in my life is that when you have cancer, you should feed yourself so you can fight the cancer. But if you take chemo, it makes you sick, you throw up, you get hernias, and you can't eat very well, so you starve yourself and the cancer wins.
I debated about talking about glutathione and cancer at all at these upcoming conferences. And the reason is that a lot of oncologists have been taught that cancer cells make glutathione in higher amounts, and if you add glutathione, it's not good. They'll be more resistant. The cells will be more resistant to the oxidative therapy they've been given, radiation or oxidation, chemotherapy. They used to call chemotherapy radiation mimics, by the way, so that's really what's happening. They're trying to create oxidation stress in there. And, but the focus has been on the cancer, and there's been very little work on the patient. And I found an article that gave me a lot of courage to go forward that was published. Mahajan, M-A-H-A-J-A-N, wrote a beautiful article, and I think it's online, that shows, she was looking at inflammation, which is calmed by adenosine, and there's an adenosine enzyme that breaks down adenosine. And so she showed that adenosine is, this ADA is increased in breaking down adenosine, allowing more inflammation, but she also looked at glutathione. And in breast cancer of any type, glutathione was significantly lowered compared to normal. So there's something happening in the whole body that people are being depleted of glutathione, and I can go into the mechanics of that. There's a fellow named Lisanti, L-I-S-A-N-T-I, who's written over 100 articles on this in the basic science, and shows the mechanism of oxidation stress causing these changes that Warburg initially described back 80 years ago. And Lisanti took it one step further to demonstrate that the glycolytic pathway in lactic acid actually feed a mitochondrial persisting cell line that is present in the majority of cancers. And more and more is coming out on this. And it's really fascinating stuff. I mean, I never imagined that I would understand any of these, but it's been the beauty of glutathione to take me. I mean, I've done a lot of areas of medicine in my past experience, but glutathione has been a vehicle that's taken me and allows me to understand articles in many, many areas. Next person.
Hi. My understanding is that the glutathione helps move toxins through the cell membrane. Is that correct?
Yeah, that one article suggested, yeah, it facilitates the removal of toxins by helping carry them through a number of mechanisms out of the cell.
So if you're taking glutathione and you have biotoxin illness or heavy metals, do you need to take a binder so that you're moving it out of your body, such as like bentonite clay or activated charcoal?
I think you're answering your question, and yes, I encourage that. That's why I mentioned earlier, anytime you're doing a detoxification, you want to have good bowel function. You don't want to be holding on to the stool. You don't want things to be staying inside of you. You want to have good, regular, you should have bowel movements twice a day. I don't know, should we do a show of hands? I mean, if you're not, you're not moving stuff out quickly enough. And the other thing that somebody pointed out in a conference was, ask your patients, when you eat corn on the cob, we don't always digest all the corn, so some may come out in your stool. you want to ask, how long does it take to come out? Because sometimes people are having bowel movements, but their corn will stay in their system for 4 or 5 days. And so it's, you know, you want to be moving stuff through your system. And yes, various binders are a good idea when you're doing any detox, because that's the way you get rid of toxins. You put them out through the bile and or the urine.
I have one more question. I was reading Richie Shoemaker's book on mold illness,
Yeah.
and he estimates that 25% of houses and structures have water damage, and I'm wondering how, and he also thinks that chronic fatigue syndrome has a mold exposure, that it's really a mold exposure.
I would refer you to Brewer's article. Put Brewer and mycotoxin. I think he gave the first study that I've seen. There have been some anecdotal studies reporting anecdotal benefit in treating people with mycotoxin illness, and they use liposomal glutathione in that treatment. And that spurred me to write this article that was published this year on the effect of mycotoxins depleting glutathione. But in Brewer's article, he showed that these toxins are present in people. And I don't think we have studies, you know, large numbers yet showing that as people get better, these toxins go down, but they use a variety of treatments, including binding agents for some people, liposomal glutathione, antifungal nasal spray for others. I mean, I've been treating mold-related problems for 30 years, so it's kind of, there's some value to hanging around, I guess, because I'm finding all the answers to these things that you can see empirically. You know, people have been, I wrote an article, I tried to get an article published on Candida yeast in 1985, and I couldn't get it published in the mainstream journal. I published it in the ACAM journal, and I have a copy if you want to read it. But the point is that the higher the antibody response to the Candida yeast, the person either felt better right away, or the people in that group felt terrible because you're killing yeast and you're getting a Herxheimer die-off reaction. People with low levels didn't notice anything at all. It was really fascinating, but we weren't ready to hear about that yet. And so to see this kind of work, but it's coming out the mycotoxins irrespective of your antibody response. So it's creating cell responses and membrane responses. I'm trying to correspond with some people about that now. But my experience has been really positive.
How many people at social functions have bowel conversations, out of curiosity?
How do you avoid mycotoxins?
Well, we're all exposed to some mycotoxin. We're all exposed to some.
Yes, of course.
And so this particular article specifically addressed people that have been living in houses with known water damage. And water-damaged houses often will develop toxins in the walls. And some of these toxins will be associated with mold release, and some of the toxins are released like from Stachybotrys. Stachy is from the Greek word sticky, and so it doesn't release a lot of spores in the air, so you may not find it, but the toxin has been identified being released. So we're all exposed to some mold and mold toxins.
We're allowed to eat mushrooms, though.
Of course. As long as you get along with them. You know, that may be why some people don't get along with certain things.
Intense anaerobic exercise, like weightlifting, generates free radicals. And there seem to be two schools of thought about addressing that. One school says that one should take vitamin C, resveratrol, etc., before that exercise. And the other school says, no, you should not take antioxidants before exercise, because otherwise the glutathione, the stress of the exercise causes glutathione to be released. And so which school of thought is right?
Well, I think people, for example, who've had a heart attack, they put people on exercise right away. I think you ought to know their glutathione levels. Glutathione is a standalone predictor of progression of heart disease, atherosclerosis, and heart attack. And in fact, they tried to put people who'd had a heart attack on arginine, and they had more problems. You need glutathione to prevent the formation of the free radical from arginine, the nitric oxide and the nitrotyrosine, nitrosative agent. So there are certain situations where you should take the antioxidant first, and then there are other situations, as you get stronger, you want to develop your own, and you can take it later. If you have a lot of aches and pains after exercise. Yeah. I used to take it, for example, I used to do a hike. I'd go up a really steep hill, and about halfway up that, I'd try and jog up that hill, which I couldn't do. But about halfway up, I'd be really winded, and I'd take some of the liposomal glutathione, and I would feel more energetic fairly promptly. It could be psychological, I will admit. But I did reference that article on Marathon is developing these mechanisms to regenerate your glutathione.
Hi, my question.
Yeah.
My question is, how does liposomal glutathione compare to the two other delivery mechanisms, IV, intravenous, and IM injection?
Well, I don't know about IM, but I addressed that with the animal study that shows that we get about 75% of the function of removing the toxin from the liver of the animals with cobalt-60. And the advantage with the oral liposomal is you can take it every day, a couple times a day if you want to, where you're not going to have that luxury with an IV. I don't know about injection. I've not done that. And the other, yeah, it gets into a lot of complicating factors. I mean, there's clearly, Gale's EVOX study showed that the liposome glutathione goes into cells much more efficiently, 100 times more efficiently. So you get this trade-off. You get a high burst of IV, but you get the continuous exposure with the oral. Okay.
Thank you, Dr. Guilford, for mentioning glutathione and autism. I also forgot to mention that Dr. Susan Downs has just published a new paper in Biomarkers and Autism.
Great.
And Susan also mentioned the importance of glutathione for protection against oxidative stress. Do you have any more
Thank you very much. I appreciate
information on that with autism and glutathione?
Well, a
Anything
lot
with
of doctors who treat children with autism use glutathione. I think there's a growing awareness that autism is deficient. I mean, glutathione is deficient in that condition. When you look at this paper by a lady named Gu, that came out, I think, in 2012 or 2013. If you put in GU and autism, she shows clearly that these children are missing the enzyme that manufactures glutathione in certain portions of their brain. I think the hippocampus and what's the back of the brain? But anyway, certain portions of the brain. Yeah, cerebellum. Thank you. And so it begs the question: are these kids born with an inefficient system to begin with, and then they develop all these secondary problems that you see? I mean, is that related to low glutathione in the beginning? And then when you just try and raise their glutathione, it doesn't necessarily solve the problem. You've got all these secondary things, not to mention misformed pathways and things like that.
I have a testimonial about glutathione. About 15 years ago, I was in a car and we were rear-ended at a stoplight in Los Angeles, and the airbag mechanism detonated and exploded and filled the car with sodium azide, which scorched my lungs.
Wow.
And fortunately, who was it? Dr. Heusser, who is a holistic MD in LA, Thousand Oaks, he knew to use glutathione in a nebulizer. And other doctors I had seen all said, your lungs are never going to heal. You're going to be coughing for the rest of your life. And takes forever to sit there and breathe a nebulizer, every single day, 2 or 3 times a day. But you know what? Within about a year, my lungs healed.
That's fabulous.
And I didn't. Your product didn't exist.
Yeah,
I would have
it
taken
didn't
that
exist.
too.
No, I appreciate that endorsement of glutathione. I don't think medicine has any awareness of what glutathione can do with people. I mean, there's just not been an efficient way that people can get it on a routine basis. I'm really happy for you and to hear that story. Thank you.
What would be the summary for people that came late as to what to do when you go home? And second question is about, were you the one that talked about vitamin C infusion with Dr. Levy several
years ago?
Yeah.
Yeah, I think we both gave a talk the same day years ago, yeah. You can go to my website, drguilford.com, and under publications, just below, I can't remember, I think it's right before those labs that I mentioned. I have a glutathione for physicians who are new to glutathione, kind of a review. And then the article online on mycotoxins gets into the nuance of the mechanism of preventing these enzymes from working, but I also have a section on glutathione in that article that goes through all these pathways that I showed. And they're non-commercial.
Then the vitamin C, help with like shingles? Would it kill the chickenpox virus inside the system? Or
Well, it's fascinating. Over the years, particularly from this group, there have been individuals who promoted very high dose vitamin C. And there's actually, when you go to the literature and you read about vitamin C and glutathione, there's an article that shows that the various forms of vitamin C actually stimulate the formation of glutathione because of its oxidizing-like effect. And I've seen great things. I've given vitamin C in various doses higher than the low dose, which is somewhat antioxidant. Somebody asked that earlier. I saw a lady just a couple of weeks ago who had a severe shingles eruption over her hip, and she was in a lot of discomfort. And I put her on the liposomal glutathione to support her glutathione and gave her a fairly low dose by the standards that have been promoted for vitamin C in that condition. And 2 weeks later, she's much better. She's probably taken 2 or 3 IVs, but also the liposomal glutathione on a regular basis. And we have a unpublished study. We tried to get a grant to do more work, but it was done at SRI, of all things. I mean, it's a great write-up. The write-up is brilliant. I don't know. She didn't get funded. This young lady didn't get funded because she was a new researcher, and they said she should have applied to the new researcher, and they didn't even grade the write-up. Getting grants is really difficult. But the point I wanted to get to is that in the study, she showed that the higher in this type of cell that they used, higher dose of liposomal glutathione they put in the cell culture, the better the cells did, where plain glutathione just had a flat, straight line. It had some benefit but didn't change. So there was an effect that seemed to increase with dose. But I don't have clinical studies in that regard, no.
so the vitamin C would help with Lyme disease also? And no?
Yeah, I'm not going to get into treatment of diseases, happily. Each case is specific.
Say, Tim,
Yes.
you told me a story once which is relevant to his question about shingles. And you treat so many patients, you probably forgot this, but I've always used it as a way to explain the power of large doses of vitamin C. I sent you a patient, and you treated her successfully with 25 grams, I think 3 or 4 days, different days. And but at the same time, you told me about another patient you had who was reluctant to try biomolecular medicine. He thought if it was going to work, his doctor would tell him, this kind of thing. But his shingles was so terrible, his wife finally got him to come in. You were treating his wife for mercury poisoning. And he came in, and his eye was swollen shut. Do you remember this story?
Yes.
Oh, yeah, and I think it's very dramatic. And so you started giving him the vitamin C, and in the process of the first treatment, by the end of the first treatment, which took an hour or two, his eye had opened, and the most of the swelling in his face had disappeared.
Thank you for reminding me of the story, Phil.
That's a great story. I think it's very important because...
Well, I think it's really important that you support these people's glutathione, and you may not need to have as high a dose C. And that's the point I'm making today. That's the story I'm telling you today. And I know that you've been a big proponent of high dose C, and I'm not against it. I mean, I'm all for it. But you need to be careful. You just can't start people out with big doses of C. But unless you're giving the IV, you may do what you like. Thank you. And I heard a great story about that earlier.
Is N-acetylcysteine effective in increasing glutathione? And if so, what's your recommendation?
Well, NAC has been documented to raise glutathione. That's N-acetylcysteine. In one of the studies that we have, it was shown in cell culture that the liposomal glutathione goes into cells 1,000 times more efficiently than NAC. The liposomal glutathione that I work with. And that study is not online, unfortunately. It's not online, but I can send it to you if you write me for educational purposes. And there may be human work in that regard coming out. So NAC is fine as long as you're healthy, but you need to look at this whole series of articles by Venk and Araman, because the third one talks about NAC in neutrophils, and it's fascinating that it may not be the ideal thing. I'm sorry, go ahead, Dr. Hahn.
Yeah, since the glutathione is produced in our liver, what type of diet would you recommend? And also, have you noticed any glutathione level difference between the vegetarians versus meat eaters?
Well, I haven't really seen many vegetarians recently. The few that I have are deficient in B12, and so they don't make glutathione. Back at that time, I didn't have a good glutathione test to run, but they are at risk for having low glutathione. And this came up from somebody else who's an expert in glutathione. Was talking to someone who was going into a endemic area of the current virus problem, and he was HIV positive, and these people are low glutathione and vegetarian. And the comment to him, not from me, but from this other researcher, was, "You are really at risk." But I don't know. Avocados contain a little more glutathione. It's really the production in the body that's critical. I'm not aware of a diet specifically that will raise glutathione. Of course, eating Brussels sprouts and things like that will stimulate the formation of glutathione. So I think those are important. Yes, sir.
Is this something available over the counter that you can experiment with as a supplement, or do you try to
It's sold primarily through physicians, and if you could get it through your physician, that would be the best way to...
Do you know who might carry that by any chance?
I happen to carry it, but I was thinking this lady who's a naturopath could order it for you.
Just asking.
Yeah, appreciate the question very much. Yeah, I carry it. I've used it a lot, and I use it in almost every patient I see, and because they're coming into me sick. Nowadays, I don't see anything that I've had a great experience treating routine nasal allergies, inhalant allergies and things. I don't see many patients. I saw a young man he had inhalant allergies that were really bad this spring. He's much better. He's presumed Lyme, and he's been on antibiotic treatment for a year and a half, and we're just getting started in his workup. But the first thing comes back on a SpectraCell test, intracellular nutrient analysis. His glutathione level is rock bottom, but his cysteine is adequate. Now, what's that telling me? It sounds to me like he's not making glutathione, and he's clearly not making glutathione. He's low. And intriguingly, in his history, he was sent for me to evaluate metals, and we're going to get there. But he also lived in a house that had mold under the flooring for years, and so he also could be a mold candidate. So it's very interesting to see the similarity between these mechanisms and the outcome, with chronic fatigue. Is fascinating.
What's the story on this acetyl form?
I thought I addressed that, but obviously not adequately. But the point here is that this is an older form that was documented with some absorption early on, but it's not been documented to get into cells. And I don't have studies with it because I only study the product that I work with. And there may be great results with it. I just can't attest to that. But I can tell you that the liposomal form has been working great for me. I'm glad Bernd Friedlander's here. He helped me with a number of questions. I appreciated that. So you don't think I'm telling you everything just from a biased perspective?
I have a friend at church who has just come down with shingles just about a week ago. I don't think she'll get into your office for the vitamin C. It's a little remote that it would happen, but if I got some glutathione to her, liposomal, is that going to help without the vitamin C, or do you have to have them together? And would it help a lot if she took that, like what did you say, a teaspoon twice a day?
I'd be interested to know what her glutathione level is. It's interesting that glutathione goes down with age. It's one of the few things that you can measure clocks with age. The longer you're on the planet, the lower your glutathione becomes. So I don't know this person's age, but if she's elderly, it's likely she's low glutathione, and so that may explain why she was susceptible to the virus in the first place.
She's in her 60s.
No, that's not so old anymore, is it?
Yeah.
But it may help. It may be very helpful. It may be very helpful, but it may not be quite as quick as the high-dose C stories that you heard earlier.
Well, if she took a lot of, see, I don't think she can come in and.
I would suggest, my experience is, and I tell everybody to start low and progress up, because if you're low in glutathione, I mean, when you start the Readisorb Glutathione, things start moving. You could also have a Herxheimer type experience. We've documented that it helps your cells kill tuberculosis, and we have more information coming out. I mean, that's a pretty tough bug. And we have more information coming out. So I start everybody low. I start them on a 1/4 teaspoon, work up to a half, 3/4, and 1 teaspoon twice a day.
Okay, I don't think she can afford the IVs of C. Could she take pill form and a C and or is that a waste? Is that
No, I don't think it's a waste.
take
I don't think it's a waste. I'm awkward recommending therapies, especially through other people, but I understand your concern and compassion, and I praise your concern and compassion. Just don't ask me to recommend treatments for anybody, because I'm not going to do it. I'm not going to do it. That's a trap. I'm not going there.
I think it's time to end and give Dr. Guilford a hand.
Thanks for coming out. I appreciate it.
Thanks, Tim. I've known Tim for a long time. I think when I first came up here, you were a patient, and you were sitting there, and I was using some kind of therapy on you.
See you. I forget.
San Mateo.
Yeah, I forget why you were right
No, I
around
used
the corner
to,
from me.
in the 80s, I developed a company called Real Life Research, which was the first liposomal delivery system ever developed for amino acids and B12. And then I worked a little bit with the company that you're working with, Dan, and Biozone, in developing liposomals. But it's one of the best ways to deliver anything is liposomal. There's no doubt. In the 80s, we were ahead of the game, but the public wasn't. Listen, I want to make an announcement because a lot of you are interested in ozone, especially in water treatment and rectal treatment. And as you know, Robert Rowan and Frank Schallenberger and Sylvia Menendez is coming back in October, November to give a big conference here. She's a world leading expert in ozone, and predominantly in Cuba, they only do rectal ozone, nothing else, because most people can't afford it. And I think he needs it badly. I really recommend Dr. Hussam to get him in your chamber and do some ozone therapy because he's going to burst. So what we are making it available, I told you I've been working on getting a unit that is very reasonable, that has certain features, and one of the features, I've been working with ozone since the 80s with the Olympics. So I've learned a lot about ozone therapy. I know how it works, how it helps to heal, wound healing, as you know how functional and how benefit is. And Sylvia Menendez always emails me her updates and tells me more and more about her work and the recommendation. If you want an ozone device really inexpensively, and here's the machine. As you can see, we have the unit there with the whole setup, everything, and you go into www.ozone.oils.com. I have cards here, and we're making it available for $800, between $800 and $900 for the whole system, and it has the bags, everything, and it's easily operated. It can be also used for ozonated water, and that's another feature. Another thing also, on September, I'm going to be giving a lecture at the Holistic Arts Fair in San Jose, 27th. One thing I'll mention to you, there's something very exciting happening today, and if you don't know who Gilbert Ling is, L-I-N-G, who knows Gilbert Ling? You know him. You know how he's probably the most brilliant scientist of our time. I've had a 2-hour discussion with him and Raymond Damadian. Damadian is the inventor of the MRI, the phonar, the nuclear MRI, and there's another component. It's about the cells. We don't understand the function of the cells, and the key is what Gilbert and Raymond and a guy by the name of Gerald Pollack, Cells and Gels, the Engine of Life. Once you understand how cells work, you will understand the basis of life. And his new book is called The Basis of Life. And that's why you never want to have a CAT scan done. You never want to have a PET scan done. It will never pick up cancer. There's another factor that cancer, it's a swelling mechanism of retention of water. And this relaxation T2, any radiologists here? We just had if you can go on Len Saputa's website, we just did an oncology 1.5-hour program, and it explains a little bit about what we're doing with cancer and the new approaches. And we did have 2 oncologists, radiologists there. And one of the things I asked them about, and the radiologists knew about it, it's T2 relaxation time. That is the #1 factor that you want to measure in every cell, is the relaxation of T2. Cancer cells have a prolonged relaxation time. They don't stop. The only basis for determining that if you have a successful treatment is by reducing T2. This is the new science. This is the absolute new science. You will know if your therapies are working by measuring through a magnetic resonance or phonar if T2 relaxation prolonged time is reduced, and the radiologist knows how to look for that. That's why the only thing that you should always advise is an MRI, not a CAT scan or PET scan. They actually cause DNA damage. They actually damage the hydrogen bond, the DNA, the nucleus of the cells, and all of that, and also they damage the lattice of the cell. The cell is predominantly 2 things, water and protein. And it looks like a gelatin molecule, and that's why it's called cells and gels, the engine of life. I'm going to talk more about that, and we're finishing up a study with Dr. Elizabeth Mazzio and 3 Nobel laureates in her staff that won Nobel scientists. We're measuring every compound that has anti-tumor, anti-proliferating mechanism, anti-mitotic, without causing any toxicity levels in the body. And we're also measuring epigenetic factors, which is a factor in genetic mechanism of aging and all that. We're looking at HDOC inhibitors, everything, and we're looking at neurogenesis. So here's the card. If you want to get a hold of, call them for the ozone therapy. And ozone and glutathione together have tremendous benefit, much better benefits we have shown it than vitamin C by itself. Now, if you use glutathione, you use ozone and then vitamin C, you even have better results for anything. And that's what we're doing in San Francisco, and we're seeing the evidence there right now.
We have 2 cards on the table, one for Tim Gallagher and one for Susan, if you'd like to sign those for them. Let's take 10 minutes and we'll come back for a short presentation.